Spectral Karyotyping? Why? Detailed explanation. 1. Introduction. Spectral karyotyping, SQI, is a modern molecular cytogenetic technique that enables the simultaneous visualization of all human chromosomes in different colors. This approach revolutionized cytogenetics by allowing precise detection of chromosomal abnormalities, especially when conventional karyotyping, like G-banding, is insufficient. Developed in the 1990s by spectral imaging scientists, uses fluorescence in situ hybridization, FISH principles, but extends them by labeling each chromosome with a unique combination of dyes. Plays a vital role in research, clinical diagnostics, and oncology. Spectral karyotyping, SKY, is a multicolor FISH-based imaging technique in which each chromosome is painted with a mixture of fluorescent probes, each tagged with specific fluorochromes. A spectral imaging system detects and distinguishes these probes, giving each chromosome a unique spectral color. The result is a karyotype image in which all 24 human chromosomes, 22 autosomes plus X plus Y, are displayed in distinct colors. 3. Indications. SKY is indicated in cases where conventional cytogenetic techniques are inconclusive or insufficient. Cancer cytogenetics. To identify hidden, cryptic translocations, marker chromosomes, or complex rearrangements in leukemia, lymphoma, or solid tumors. Congenital developmental disorders. Suspected chromosomal abnormalities in patients with birth defects, developmental delay, or intellectual disability. Prenatal diagnosis. If ultrasound findings or family history suggest chromosomal defects. Reproductive genetics, for couples with recurrent pregnancy loss, infertility, or suspected balanced translocations. Research, for studying genome evolution, species comparison, and mapping chromosomal changes. 4. Used for clinical genetic diagnosis, identifying hidden chromosomal rearrangements in tumors, detecting complex structural abnormalities, e.g. insertions, derivative chromosomes. Research in cytogenetics, evolutionary biology, and comparative genomics, providing supporting evidence for targeted therapies in oncology. 5. Why do need of this test? Conventional G-banding or FISH has limitations. G-banding cannot always identify subtle rearrangements or complex karyotypes. Single probe FISH studies only one chromosomal region at a time. SKY allows full chromosome visualization in color, identification of hidden structural changes, balanced, unbalanced translocations, greater accuracy in cancer diagnostics, guiding prognosis and treatment. 6. What happens during the test? The procedure involves multiple technical steps. 1. Sample collection. Blood, bone marrow, amniotic fluid, chorionic villi, or tumor tissue. 2. Cell culture and harvesting. Cells are cultured and arrested at metaphase when chromosomes are most visible. 3. Chromosome preparation. Chromosomes are spread on microscope slides. 4. Probe hybridization. Chromosome-specific DNA probes labeled with combinations of 5 different fluorochromes are applied. 5. Spectral imaging. A spectral interferometer and computer system analyze each chromosome's color signature. 6. Image analysis. Specialized software assigns a false color to each chromosome pair, creating a full rainbow karyotype. 7. How long for my results? Turnaround time, 1 to 3 weeks. Depends on type of sample, blood versus tissue. Requires successful cell culture and high-quality metaphase spreads. 8. Prepare for this test. No special preparation is needed for most patients. For blood samples, fasting is not required. For prenatal samples, amniocentesis CVS, preparation depends on obstetric guidance. Patient should inform clinician of current medications, previous genetic test results, family history of genetic disorders. 9. Risks to, from blood draw, minor pain, bruising, infection risk. From prenatal sampling, amniocentesis CVS, small risk of miscarriage, bleeding, or infection. From test itself, no radiation or chemical harm, only lab-based analysis of cells. 10. Normal values. A normal SKY karyotype shows 46 chromosomes, 22 pairs plus XXY. Each pair colored identically with no additional or missing material. No abnormal color patterns indicating rearrangements. 11. Interpretation results. Normal result, standard chromosome count and structure. Abnormal result, numerical abnormalities, extra missing chromosomes, e.g. trisomy 21 in Down syndrome. Structural abnormalities, translocations, exchange of chromosome segments, insertions, deletions, gain or loss of chromosome material, duplications, extra copies of segments. marker chromosomes, unidentifiable fragments. Factors affecting results: poor cell culture growth, insufficient metaphase cells, degraded DNA or improper hybridization, low-quality microscope slides, technical operator errors in spectral imaging, mosaicism, different cell lines present in the same patient may complicate interpretation. 13. Clinical significance. Oncology detects hidden chromosomal translocations in leukemia, e.g., complex karyotypes in AML. Identifies tumor-specific chromosomal rearrangements. Genetic counseling helps families understand recurrence risk of chromosomal abnormalities. Prenatal diagnosis guides decisions in pregnancies with suspected chromosomal defects. Reproductive medicine explains unexplained infertility or miscarriage. Research helps map genetic evolution and interspecies chromosomal rearrangements. Meta 14. No more. Sky versus other techniques. Conventional fish uses one or few probes. Sky analyzes all chromosomes. Multicolor fish, M-fish, similar to SQUY, but uses slightly different imaging technology. Chromosomal microarray, CMA, detects copy number changes but not balanced rearrangements. Next generation sequencing, NGS, provides base pair level resolution but more costly. Sky remains highly useful where balanced chromosomal rearrangements need detection. 15. Conclusion. Spectral karyotyping, SKY, is a powerful diagnostic and research tool in genetics. By assigning unique colors to all chromosomes, SKY enables the detection of both numerical and structural chromosomal abnormalities with high precision. It is particularly valuable in cancer cytogenetics, reproductive medicine, and prenatal diagnosis. Despite requiring specialized equipment and expertise, Sky bridges the gap between conventional cytogenetics and modern molecular techniques, making it an essential part of advanced genetic diagnostics. Thank you. Have a nice day.